In the early months of 1981, there was no plague, no parades of activists, no quilts laid out in the National Mall, no global conferences or public service announcements. The headlines still buzzed with post-election energy. Ronald Reagan had just taken office, and the American news cycle was steeped in international tension, Cold War echoes, and economic unease. Cities like San Francisco, Los Angeles, and New York pulsed with their own dramas, glitter, and disco beats. Amid this noise, a different kind of silence was settling in, soft as fog and just as obscuring. There were no warning sirens when the first men started dying. The earliest whispers came from the emergency rooms and oncology wards. Doctors in New York and California were seeing something odd. Young, otherwise healthy men, often in their 20s and 30s, were presenting with rare and deadly illnesses usually seen in the elderly, or those with severely compromised immune systems. Kaposi's sarcoma, a rare cancer with dark purple lesions that bloomed across the skin, began appearing in clusters. Pneumocystis pneumonia, a type of fungal lung infection, suddenly became lethal in men who had never shown a day of illness before. These cases were not only odd, they were fatal. On June 5, 1981, the Centers for Disease Control and Prevention, CDC, quietly published a short article in its Morbidity and Mortality Weekly Report, MMWR. The title was clinical: Pneumocystis pneumonia, Los Angeles. It was 5 short paragraphs long, just 5. The report noted 5 young gay men in Los Angeles, all previously healthy, all now suffering from this unusual pneumonia. 2 of the 5 were already dead. Most Americans never saw the report. It wasn't front-page news. The New York Times buried a brief mention deep in its June 1981 issue under a medical column. Just a few sentences. There was no name for the disease, no funding, no presidential address. The gay community, already accustomed to silence, began whispering among themselves. Something was wrong. A community in the crosshairs. To understand why those early signals were so easily missed or ignored, it's important to understand the broader context of 1981. In major cities like San Francisco, a sexual and cultural liberation had blossomed over the past decade. After the Stonewall riots in 1969, the 1970s had given rise to an era of hard-won joy for many LGBTQ+ Americans. Gay men, in particular, had begun living openly, creating community centers, bathhouses, nightclubs, and entire neighborhoods where they could live as themselves for the first time. This was not merely a period of partying. It was the building of culture. The Castro District in San Francisco and Greenwich Village in New York were not just places to go out. They were places to belong. Pride parades gained momentum. Local gay newspapers covered everything from politics to poetry. Activist groups had started forming long before the virus arrived. But there were cracks in the foundation. Despite their growing visibility, LGBTQ+ people still faced massive discrimination. Homosexuality remained pathologized in the medical community. Only recently removed from the DSM in 1973. Many gay men were estranged from their families. Few had legal protections for housing or employment. Anti-gay violence remained widespread and underreported. Police raids on gay bars still occurred, and jokes about faggots remained mainstream. In this social climate, when gay men began getting sick, few outside the community took notice. Fewer still took it seriously. The first doctors who listened. In Los Angeles, Dr. Michael Gottlieb was among the first to publish findings linking these strange illnesses to a larger pattern. His report, in collaboration with the CDC, included a critical observation. The affected men had immune systems as depleted as transplant patients. Some unknown agent, was destroying their T cells, a crucial component of the body's immune defense. In New York, Dr. Alvin Friedman Keene was seeing something similar. Young men with Kaposi's sarcoma. Not one or two isolated cases. Dozens. By the end of 1981, cases were being reported in San Francisco and beyond. Patterns were emerging, but there was no central authority yet to track them all. There was no name, no test, no protocol. Just a rising sense of dread. Clinics that served gay populations began noticing the influx. Some doctors tried to warn public health officials. Others, fearing their reputations or funding, hesitated. The silence was both institutional and societal. Bureaucratic inertia met cultural stigma, and between them grew a void where action should have lived. The birth of grassroots resistance. In the absence of official help, the community began organizing itself. In New York City, a group of men formed a volunteer group that would become the Gay Men's Health Crisis, GMHC. Initially, they handed out leaflets and set up hotlines. But there was no single moment when the epidemic became real. It didn't arrive all at once like a hurricane or an earthquake. Instead, it seeped in, month by month, person by person. Too slow for an alarm, too fast to stop. By the spring of 1982, in hospital rooms and hallways, people began using a new term more frequently: the gay cancer. In newspapers, it was whispered. In nightclubs, it was feared. On government forms, it still didn't exist. The Centers for Disease Control and Prevention, CDC, continued tracking cases, and by mid-1982, they were appearing in over a dozen states. Doctors were now seeing gay men with both pneumocystis pneumonia and Kaposi's sarcoma, sometimes simultaneously. The disease didn't follow predictable rules. It decimated immune systems and opened the door to infections that were usually treatable or harmless in healthy people. What shocked many healthcare providers was the nature of the decline. One day, a patient might be walking and talking. A week later, he was in bed, unable to breathe, racked by night sweats, and wasting away. Some lost their eyesight. Others developed neurological complications that would later be known as AIDS dementia. And yet, the United States government remained largely silent. Budgets were tight. Moral panic was easy. And those dying, mostly gay men, many of them poor, people of color, or drug users, were not seen as sympathetic victims by much of the public or policymakers. GRID becomes AIDS. In July 1982, the CDC introduced a new term, AIDS, Acquired Immune Deficiency Syndrome. The name, though still vague, removed the most damaging label, gay-related. This was a crucial shift. Researchers had begun seeing similar immune breakdowns in other populations: Haitian immigrants, intravenous drug users, and hemophiliacs. The gay disease narrative no longer held, though the stigma remained deeply entrenched. Still, the change in name did not come with major funding or visibility. In the absence of government leadership, it was left to volunteer organizations and terrified citizens to respond. The grassroots response: love in action. In New York, the Gay Men's Health Crisis, GMHC, had grown from a living room gathering into a full-scale operation. Volunteers, many with no medical training, took calls from frightened men experiencing their first symptoms. They visited hospitals where friends lay dying, many unattended by family or clergy. They created pamphlets warning about transmission, sometimes speculating based on rumor because scientific knowledge was scarce and misinformation spread fast. Across the country, in San Francisco, a parallel effort emerged: the San Francisco AIDS Foundation. And in Los Angeles, AIDS Project Los Angeles was formed. These organizations became lifelines, not only for medical support, but emotional survival. They pioneered services like buddy programs to care for the sick, home visits and legal aid for those evicted or fired due to diagnosis, funeral arrangements for people disowned by families, counseling services for grief, stigma, and end-of-life care. Many of the people providing these services would themselves become ill within a year or two. A crisis ignored. By the end of 1982, over 700 people had died of AIDS in the United States. Still, President Ronald Reagan had not publicly mentioned the word AIDS. In fact, the topic was routinely mocked during White House press briefings. One notorious exchange between Press Secretary Larry Speakes and reporters in 1982 shows this clearly. Reporter: "Does the president have any reaction to the announcement, the Centers for Disease Control in Atlanta, that AIDS is now an epidemic, over 600 cases?" Speakes, laughing: "What's AIDS?" Reporter: "Over a third have died. It's known as gay plague." Speakes: "I don't have it, do you?" Laughter. This was the tone from the top. Mockery, shrugs, dismissal. There was no National Institutes of Health, NIH, task force. No dedicated funding stream. Scientists working on AIDS research had to scrounge for grants, rely on sympathetic donors, or repurpose labs originally used for cancer or immunology. The media largely followed suit. Major newspapers rarely covered the disease, and when they did, it was often tinged with moral judgment, if not outright hostility. A Los Angeles Times editorial speculated whether AIDS was nature's revenge. One New York columnist openly questioned if those infected deserved their fate. Hospitals as battlegrounds. By 1983, entire hospital wards in urban centers became overwhelmed by AIDS patients. Many doctors refused to treat them. Nurses were afraid. Patients were sometimes left in isolation, their food trays untouched. When they died, funeral homes refused to take the bodies. Fear of contagion was rampant, even among medical professionals. And because AIDS had no cure, no treatment, and no vaccine, those with it were often viewed as already dead, disposable. But within this chautaidisa, in the early years of the AIDS crisis, death did not come with ceremony. It came quietly, behind drawn hospital curtains, in apartments filled with pill bottles and silence. It came with the whisper of unanswered phones and the click of eviction notices slipped under doors. There were no candlelight vigils yet, no names carved into marble, only grief, anonymous and unspoken, worn like a second skin. By 1985, the epidemic had killed over 12,000 Americans, but the number failed to capture the emotional wreckage it left behind. In cities like San Francisco, Los Angeles, and New York, entire neighborhoods had begun to feel like ghost towns. Restaurants and stores once filled with young, energetic gay men now echoed with absence. In apartment buildings, mailboxes sat unopened, names peeled off doors, and landlords quietly changed locks. Communities built from grief. With every loss, the community responded not only with mourning but with creation of organizations, rituals, and memory. Some of the earliest long-term survivors became the keepers of the dead. They organized photo albums, sewed funeral clothes, made cassette tape memorials, recorded messages from lovers in their final hours, and planned living wakes. Entire networks emerged around caring for the dying, not just physically, but spiritually. It was a community effort born of necessity. Hospitals still turned people away. Families still disowned their sons. Clergy refused last rites. In many cases, the people who buried the dead had no legal rights to do so. Lovers were locked out of hospital rooms, denied information, and erased from obituaries. They mourned in private, behind veils of stigma. In this void, gay men and lesbians, drag queens, social workers, artists, and volunteers became each other's family. They invented the infrastructure of compassion from the ground up. Art as resistance AIDS activism was not only organized in marches and protests, it also exploded through art. By the mid-1980s, playwrights like Larry Kramer were calling out politicians and gay leadership alike. His searing play, The Normal Heart, debuted in 1985, giving voice to a rage many didn't yet know how to express. Kramer's words, urgent, furious, and deeply personal, helped awaken a generation of activists. Across town, painters like David Wojnarowicz and Keith Haring were creating work that screamed back at silence. Their canvases, murals, and installations depicted decay, loss, and injustice, infused with sacred anger and deep vulnerability. Their art was protest, memorial, and prayer all at once. Perhaps most powerfully, the AIDS memorial quilt was conceived in 1985 by Cleve Jones. What began as a few panels stitched by grieving friends became a monumental public work of mourning. By the early 1990s, it had grown to over 100,000 square feet, each 3x6 panel representing a name, a life, a person loved and lost. When the quilt was laid across the National Mall in Washington, D.C. in 1987, it was more than fabric. It was testimony. It was proof. It was the cry of a generation who refused to be erased. Policy and power. While the grief was personal, the fight was political. AIDS exposed the fault lines of power, privilege, and neglect. By the late 1980s, organizations like ACTUP AIDS Coalition to Unleash Power emerged to force action through civil disobedience and bold direct action. Their slogans, "Silence equals death, ignorance equals fear," were plastered on walls, screamed in the streets, and painted on protest banners outside the FDA, NIH, and the White House. These activists demanded faster drug approvals, equal access to treatment, public health education, and an end to discrimination against people with HIV. They disrupted Wall Street, shut down the FDA, held mock funerals, and staged die-ins to simulate the growing death toll. Some were arrested, some were beaten. Many were dying while protesting. But they continued to fight, sometimes literally from their wheelchairs. Slowly, change began. The Ryan White Care Act, passed in 1990, allocated funding for people living with AIDS. More medical research was prioritized. Education expanded into schools. But these victories were hard-won and came far too late for thousands. The long echo. By the time President Ronald Reagan publicly uttered the word AIDS in 1985, over 12,000 Americans were dead. When he gave his first major speech on the crisis, in 1987, the number had grown to over 36,000 cases, with tens of thousands already gone. For many, this silence was unforgivable. Some historians and survivors argue that if the disease had first affected white middle-class heterosexuals, the response would have been immediate and robust. But because the early victims were largely gay, poor, Black, Hispanic, and marginalized, they were allowed to die quietly. The early 1980s are now seen not just as a period of crisis, but as a period of abandonment, a failure of institutions, government, medicine, and